everyone, good afternoon. I am from the Oye Innovation Hub, and guess what? I have a very prominent person, a medical practitioner, is a doctor. Yes, doctor from Ekiti State Teaching Hospital. Right, all right. So we are going to be asking him a few questions. All right, sir, can you do a brief introduction of yourself?
Thank you very much. This Professor Olofinbiyi a professor of obstetrics, gynecology, and adolescent reproductive health, and missionary the chairman, Senate Committee on University Ranking, Ekiti State University. I am the CEO of Adolescent Research Initiative and Care, ADOLFRIC, based in Ekiti State. ADOLFRIC essentially is a clinically and research-oriented non-governmental organization based in Ekiti that adopts multidisciplinary and collaborative approach to render evidence-based holistic care to adolescents in the area of sexual and reproductive health. And essentially we are into collaboration with many institutional news on adolescent sexual and reproductive health. And we are here for part of our vision here in Oye today. There was a time the burden of sexual and reproductive health challenges was so high on Oye campus, necessity fashion to invite our organization to actually collaborate in this area to stem the tide of the very huge burden of adolescent sexual and reproductive health challenges on campus, and in which we had to sign an MOU with the university, and it's part of the provision of the MOU that we are observing today. So we have to work in phases. So in phases to actually actualize the sexual and reproductive rights of our adolescents on campus. So sexual and reproductive health information, education, and care, especially in the area of family planning, in the area of infertility challenges, in the area of sexually transmitted infection including HIV, in the area of unsafe abortion, in the area of safe motherhood initiatives, in the area of gender equity and equality, in the area of sexuality and sexual behavior, in the area of the core adolescent reproductive health issue, in the area of reproductive health of the elderly, and more interestingly in the area of gender-based violence. And we are happy today to observe one of these phases of the provision of the MOU, and that's what we are doing. So we are here with our peer educators who have been taking the students through part of the issue of the first phase, prevention of unplanned pregnancy and unsafe abortion. And we are happy the way the school management has embraced it. And following this event, the event will actually train peer educators, youth ambassadors that we are going to follow up, that will help us disseminate the news. So essentially, it goes beyond health. It's part of community-based experience and services. So expected of any institution. You know, it goes beyond training, it goes beyond research, innovation, community-based experience and services. So without community-based experience, how can we be talking of innovation? So definitely some things are going to come out today. Pockets of research are going to come out today, and the students we are going to follow them up, and we are going to carve out things from them. From them also, part of the evaluation will be how do we leverage technology to reduce the burden of sexual and reproductive health on campus. So we are working on that, and we are going to do that. Thank you very much.
So, sir, can you just say something about sexual and reproductive health, right? SRHR.
Sexual and reproductive health, as I've said, is the right of everybody, especially the girl child, to sexual and reproductive health information, education, and care, free of coercion, free of intimidation, central to which is what? Equality and equity. So, especially the girl child. The girl child has a right to family planning, has a right to have a pregnancy taken care of, has a right to get adequate and quality sexual and reproductive education, even from primary school, that our parents have been hiding from them. Free of coercion, free of intimidation. So everybody is equal. You don't hide anything from anybody, especially the girl child. So that is what sexual and reproductive health is all about. That has to do what that will affect their total body, because it has been found out that sexual and reproductive health issues rank high among the health needs of adolescents and young people, especially in Nigeria. As we are talking now, a girl is being raped. As we are talking, a girl is becoming a victim of unplanned pregnancy and teenage pregnancy because no information, no linking with contraception. A girl is a victim of genital mutilation. These are the areas. So, sexual and reproductive health rights of people, especially the girl child, free of coercion, intimidation, no cultural difference. Everybody is just equal. Not that a particular person belongs to the adult or a particular person belongs to. No. Sexual and reproductive health right is sexual and reproductive health right. So, and the emphasis now is emphasis on age-appropriate sexual and reproductive. Right from birth, age-appropriate sexual and reproductive right. Even from age-appropriate sexual and reproductive health right. Thank you very much.
All right. Thank you so much, sir. We are so honored to have you on our interview today.
Thank you very
We hope to see you some other time in our